The National Health Service. Look, I really want to ask people to go and watch the board meetings like I do. And here's just a screenshot of where you can find it on YouTube, the NHS board meeting, 1st of February 2024. This one was particularly full of diamonds. And I have to say, for people watching, if you rely on the NHS, if you still want to go to the NHS, I have to tell you, the NHS is going, and it's literally going, but I want you to hear it from the horse's mouth. So this is Professor Joe Harrison, who is National Director of Digital Channels. He's also the CEO of Milton Keynes University NHS Trust. See how excited he gets by the app.
I'll start by saying that this board is presiding over what is, I believe, the biggest change in how the NHS engages with its citizens that we have seen for many, many decades. We're in a place now whereby we have got more than 3/4 of our adults who have downloaded the app. We've got 97% of our practices able to communicate with those patients. And the numbers just keep growing exponentially. And there are lots of numbers that you've heard today, but over 4 million people a day accessed their medical records last week. This is an appetite that we are fulfilling through the NHS app that people didn't necessarily know existed, but is changing the way that our citizens engage with us. And we've only just started. So the last 12 months we've presided, and Helen and the team have delivered against all of the priorities that were set, and have delivered early on a couple of them. Now, it's not often you can say that about really big tech programs in the NHS. So it is to celebrate, and one should, as a member of this board, you should be celebrating this hugely. But it's so much more than that, from a productivity perspective, from an engagement perspective, and from the way that we can and will change the way that we deliver care across our NHS. It is staggering. And let me just talk about a few of the things that we're doing. We've started over the last 12 months of putting basic functionality into the app. Stuff that people want, to be able to look at their appointments, their letters, to engage at a time of their choosing with our NHS. Our citizens absolutely love it. Have we got countrywide coverage yet? Not quite yet. No, we haven't. Is there more to do? Of course there is. It was brilliant hearing about Pharmacy First and 111. It's even better sitting here knowing that we've already integrated 111 onto the front page of the app that has already got integrated in it the Pharmacy First pathway. And so when we talk about how people get up phone to 111, I sort of hope they don't, because we know that those that are using 111 on the app have got better completion rates than those that are using it through the web. And we know that we can move more and more people to managing their own care through the app.